is Delaney Whitlow, and today we will be discussing a healthy school food proposal. Childhood obesity is a major epidemic that is affecting millions of children in America. The Center for Disease Control and Prevention estimates that about 1/3 or 25 million children are obese or nearly obese in America. Saginaw County is among one of the highest counties in Michigan for adult obesity and childhood obesity. Addressing obesity in childhood is very important, as childhood obesity is more likely to lead to adulthood obesity as well as many other health conditions and diseases. By implementing a healthy school meal program, we can combat this issue head-on and teach students lifelong skills that will impact their health greatly. Students typically receive 1 or 2 meals a day at school as well as snacks. With the bulk of students' meals coming from school, it is our job to make sure that they are getting quality nutrition as well as education on healthy eating habits. Saginaw County is among one of the highest districts in Michigan for childhood obesity. Child obesity has tripled in the last 30 years, and it will only continue to rise unless there are some major changes. 1 in 5 children and teens are now classified as obese, and the CDC estimates that 17% or 12.7 million of today's children and teens are obese. According to the Youth Risk Behavior Surveillance System, 15.3% of Michigan high school students are obese, or in the 95th percentile for body mass index. Childhood obesity can lead to many health issues that will follow children into adulthood. Children who are obese have a higher chance of being obese as adults. Children are also more likely to experience pain and fatigue with physical activity, have a higher chance of developing hypertension at an early age, and have high blood pressure. The chances for developing diabetes, heart disease, as well as many other obesity-related chronic diseases all increases as well. With the high numbers of obese children in Saginaw County, it is obvious that the school systems are responsible in part for these numbers by lacking in healthy food choices for children. If we do not take action against childhood obesity, we will be facing larger numbers of obese children. The solution to childhood obesity in our Saginaw County school systems is to implement a new healthy food meal program. This program will replace all meals served at school and vending machine foods that are unhealthy and lead to childhood obesity. By finding a healthier lunch alternative, we will be able to reduce childhood obesity in Saginaw schools. By placing healthier foods in the breakfast lines, lunch lines, and vending machines, we will be able to ensure that the children in Saginaw County are receiving healthy meals and snacks on school days, and that nutritional requirements are met for the students. By educating students on the importance of healthy eating, we will be giving the students valuable information on the importance of healthy eating and nutrition that will give them the opportunity and knowledge to make healthier eating choices. To start off, finding a healthy school lunch program is vital for this proposal to work. To do this, research will be used to find an effective, evidence-based school lunch program that have been proved to reduce childhood obesity in other schools. In addition to finding healthy school lunch programs, we will need to start replacing the unhealthy foods in the schools. We will also replace the unhealthy drink options that are in the vending machines, as soda and other beverage consumption is a leading cause of obesity among school-aged children. Finally, the education of students on healthy eating habits and healthy nutrition is vital to reducing childhood obesity rates. To educate school-age children on healthy eating habits, we will hold assemblies that will focus on the dangers of unhealthy eating. We will also implement a voluntary text messaging campaign that will send weekly healthy eating tips and reminders to those students who are old enough and who decide to participate in the program. Lastly, to complete this step of the program, we will place healthy eating posters in classrooms, in the lunchroom, and in the school hallways. These posters will highlight important eating tips and education to live a healthier life. Looking forward, the importance of addressing childhood obesity now cannot be understated. It is a trend that is only continuing to rise, and if nothing is set into place, we will be seeing a large increase in obese children in Saginaw County. Costs will be kept low by having teachers explain the posters to the children and by having volunteers run the assemblies, as there are many health advocates in Saginaw County who speak on the importance of healthy eating. Not only will this decrease the prevalence in childhood obesity in Saginaw County, but it will also educate children on the importance of healthy eating habits and help them to avoid becoming obese as adults. The goal of this program is to see a 20% reduction in the rate of childhood obesity in Saginaw County. If the numbers continue to rise, more and more children will face life-threatening health risks as well as other daily life challenges such as physical activity. This can be changed, we just have to act now.